all those things.
Can I say something? I think that, you know, this country has the greatest trauma centers.
Okay.
If you get injured in a car accident, of any place in the world, we also have the greatest surgeons of any place in the world. But when it comes to the internal and the medical side, drug for everything, that's when we run into big trouble, and that's what those ads are telling you.
Okay.
And we need alternatives to that.
Okay.
That's not only a real downside, but a very dangerous side of medicine today. And
wow.
Most of the medical doctors know that, but they don't think they have any choices and know to the people. But there are alternative people out there.
So what we are focusing on today is very vital, very critical, very important. People need to realize that there are alternatives, or there's an alternative to just, you know, peel after peel after peel. Mm-hmm. And so from that standpoint, then, help us to, first of all, let's establish what is chiropractic. And then once we look at that, we want to look at what, you know, because when you think of chiropractic, you think of a chiropractor, you think, you know, I go to see a chiropractor when my back hurts, when I've slipped and fallen and, you know, the pain just won't go away. That's traditionally the way we view a chiropractor. But from what I've gathered from just sitting with you and understanding better, there's a whole realm that most of us are ignorant to in terms of what you do and what you represent, the alternative that you provide to just being bombarded with medications over a whole range of different conditions and concerns that people would have in their health. So explain, what is chiropractic?
Well, first of all, let me say that some chiropractors, doctor of chiropractic, will specialize basically in the spine. They won't do anything else. Okay. I mean, that's their focus, and they like to do that, and that's well understood, just like medical doctor will focus in one area of medicine.
Okay.
So there are some people that really focus on the spine, keeping it aligned, flexible.
So they're specialists within your...
Well, they're specialists, but also that's the way they like to look at things. They look at the spine that way. They feel that that's the best.
That's the only thing they want to do.
Yeah.
Okay.
Now, other chiropractors will specialize in certain areas. Like we have chiropractic radiologists, we have chiropractic orthopedists, neurologists, just like medical professions. Some that deal with internal medicine, sport injuries, things like that. They go to 3 to 4 years more study and then earn a diplomate degree by passing strict examination.
Wow.
And that is what they focus. I'm more of a general practice, but I also include a lot of nutrition in mine. I've done a lot of study in orthopedics, but also do a lot of 37 years I've never done a year that I didn't add nutrition and more nutrition, study more about it.
Okay.
And for 37 years I've seen what it does, if it's well applied, clinical nutrition.
Clinical, okay.
Yeah. So what chiropractic is really, at first everybody knows we're a system that we look at the spine and the nervous system and try to make sure the nervous system is as free to operate as possible.
Okay.
We know the nerve comes down from the brain, and I mean, it control from the brain comes down the spinal cord and all the way down to our extremities, hands. It controls every part of the body. There are also two other nervous systems, the sympathetic and the parasympathetic, that are not under our direct control, but they're very important. And they run down the spine. So if you have something happen to your spine and it causes constant irritation in there, it overstimulates that area. And it can either overstimulate the sympathetic or parasympathetic or decrease the amount of stimulation, which also kind of cause some kind of imbalance within the system. Now, this may happen over a long period of time, or it can be dramatic.
Okay.
So this is what chiropractic is. It's more than just bone adjustment. What we say, you know, like people come and they say, well, I'm going to get my spine checked. I was in a car accident. I sprained an ankle.
Right.
We do joints. We do things like this. But a lot of us also specialize in an alternative to that. And the alternative is also in the fact that if we can correct something early, like a sprained back and everything, and the alignment is preserved and flexible, then the disc won't have a chance to degenerate over a period of time, which may also save them for surgery. So that's another way of prevention.
Okay. Now, give us the scope of chiropractic care in terms of, wow, we got 1 minute. Oh, man. Help us, wow, let's, who can benefit? Let's go there. Who can benefit from chiropractic care?
I think everybody can benefit. There's no doubt in my mind after so many years, not that everybody takes advantage of the benefit, but I think everybody, from young children, I've treated children that were just born, and we have special technique for that. I mean, people just say, oh my gosh.
Bring them in from the hospital.
Yeah, it's a very gentle enzyme. Those are so easy to care for because they're
That's a rough trip coming out of there, you know.
Wow.
But anyway, that everybody can benefit.
Wow, that's good. Gentlemen, I don't know where the time went for that first segment, but we're going to be back. We're glad that you all came and you're sharing with us, but we got to go to break, and we'll be back right after this.
Excuse me, ma'am. Would you like to have my seat?
A message from the Foundation for a Better Life.
Moving is so much of who we are. It's easy to take it for granted. Multiple sclerosis stops people from moving. We exist to make sure it doesn't. Join the movement, the National Multiple Sclerosis Society, at National